Thank you very much, John. I wish I could say it's good to see all of you, but I can't see any of you. So I assume you're all there, and it's good to hear all of you. Anyway, this is going to be quite different from the oil patch that we just heard about. I'm going to talk to you about at least my impressions of AI in what I will call digital healthcare, but we'll look at other kinds of healthcare as well. It goes back a fair ways. This is the first drugstore that I'm aware of, 1847, and it's become very sophisticated these days. You guys followed the acquisition last week of a drugstore called CVS of Aetna. Who would have ever thought that? Who would have thought that a drug chain would acquire one of the largest payers in the United States? But that's what's going on, and we haven't even talked about Amazon yet, which is, and neither are they, by the way, but it will be part of the future. Let me try to characterize the industry for you, and I'm going to tell you what I'm going to tell you, and then I'm going to tell you that in the old Navy way, as I understand it. First, we're going to talk about the structure, for those of you who don't know the structure of the industry. Then I'm going to talk about a little overview of the changing role of digital technology. We're going to talk about how the industry, how to think about it, because as you'll hear, it is a very complex industry. We're going to talk about a specific example of a kind of healthcare that you may have heard about called population health. It's meaningless to most people, but it's probably the biggest thing that's going on in healthcare right now, and some of the issues going forward. So let me get started on the structure, do it real fast for you. At the top of the structure, we have purchasers. Employees, government, private purchasers of healthcare. This includes you and all your employers that you're well aware of. We have insurers who actually pay for a lot of this that is not paid for directly by the employers. And these are public or private companies. You know, we've already talked about Aetna, Humana, Kaiser, Medicare, Medicaid. So it's on both sides. And there's a lot of money that flows between those two. You'll notice that we haven't used the word patient yet, because the patient comes in later. There are providers who provide these services, and there's all different kinds of providers. There might be 6 or 7 different categories of hospitals alone. And then we have suppliers of medical products, and the more money flows that way. So this is a complex industry. This is an industry where you go to the counter, decide what you'd like to buy it, and don't pay for it. And the person who is paying for it isn't at the counter with you. So this is a very strange sort of economic equation that healthcare lives under, and it is the nature of the industry. Another way to look at it, there's the clinical side of the business, and there's an administrative side. And I mention these things because this will be relevant for our digital technology. On the clinical side, we have ambulatory care, we have inpatient care, we have long-term care, we have home care and telemedicine. And on the administrative side, we have payer claims, provider billings, healthcare systems operations, and provider information. And now, finally, we get to that word, the patient, after we have all this in place. This is a fairly large industry. As those of you who know about healthcare know, it's around $3.5 trillion in the U.S. economy now. We all keep saying that number is going to come down, and it always keeps going up. And by the way, if you thought it was simple to figure out the industry structure, I track 4,187 companies in this field. How do you actually track 4,187 companies? It's quite a difficult job, and I'll tell you a little bit about that in a second. So that's the beginning. That's the structure of the industry. Changing role of digital technology. Let me start with some medical practices and show you how many companies are in this business that actually do medicine, what you and I would think of as medicine. I count around 20 companies in psychiatry, and the median year that they started was in 1999. In respiratory care, lungs and so forth, median year is 2000. There's around 50 companies. Cardiovascular, more, median year. Ophthalmology, which is getting to be quite large now. My son runs a digital ophthalmology company in San Francisco that's doing very well. The Google folks here may know him. Then there's diabetes, median year 2006. Orthopedics, median year 1998. and cancer median year 2003. These are all fairly recent additions to digital healthcare companies in these medical fields. In total, there's 533 of these companies that I track. That's 533 out of 4,187. So something else is going on in this industry besides actually doing medicine. And this is one of the hardest things for people to get their minds around. There's quite a lot going on there. One of the things patient healthcare companies do is they gather patient data. And there's 100 or so of those. Their median startup year is fairly recent, 2004. Hospital Information Systems is another part, 1999. Advancing Treatment and Diagnostics, the part that we think of as medicine, 2002. And Current Operations is 2003. It's all about current operations in the hospital. So right now, digital technology is really inside the hospital, trying to make the hospital work better. There are all kinds of different hospitals. There are orthopedic hospitals, there are cancer hospitals, there are general hospitals. So this is a very complex field. Within current operations, what do they do there? There's therapeutic support. There's a couple hundred companies doing that. There's regulated business functions. This is dealing with Medicare, Medicaid, and all the other parts of Washington. There's care communications, actually trying to talk to one another and to talk to patients. There's around 600 companies in that field. There's aggregated data, over 1,000 companies. 1,000 companies doing aggregated data in healthcare. There's finance and administration. There's a few more there. So this gets to be a big field. In the data field, which we're almost interested in, there are learning tools. There's 150 companies in that area. Data sharing and infrastructure, there's over 300 companies there. And there's data analytics, which is 600 companies. I don't know how many times a week I get an email from someone saying, I've got this new iPhone app. It's really fantastic for healthcare. Let me show you. And the first question I have is, what are the other 599 companies out there in the field doing? And they say, oh, I had no idea. And in general, they don't. So there's 137 customers in this field, one that we're most interested in. And there was brighter print, you would have been able to see who they are there. And then we have network security, health information exchange, and IT consulting, which has become a very big area. And finally, what do business companies do? They do business intelligence, decision support, prediction and risk assessment, healthcare data analytics, which is growing rapidly, and population health, which we will talk about. Population health is the notion that we don't take care of patients in the old-fashioned way of one patient, one doctor. We take care of entire populations of patients who have similar characteristics. And we can, if we treat them as a system, this will become much more cost-effective. And so we do that. And that includes other things that are being done are oncology support, clinical data systems, critical asset managing, patient data and collection, and medical image management. This is one complicated field. I'll tell you that. It's very hard to generalize about this. You might say, well, I really don't have to worry about this because the next generation of doctors are going to be well skilled in all of these things, and the medical schools are taking care of this. I'll give you one number, probably an easy one to remember. The number of classes there are in digital delivery of healthcare in American medical schools, actually let me make it broader, any medical school in the world, is 0. Here we are in 2017, about to be 2018. There are no courses that I'm aware of. If anybody has a correction to that, I would love to know about it. But there are no courses in teaching our doctors how to do this. So they spin out of medical school, and we all think that they are data literate, and they're not. And they're eager to become data literate. You can get, after you get your doctor's degree, you have to take continuing medical education courses. There are no courses in digital delivery and continuing medical education either. So this is a very strange situation. In terms of the role of digital, this is the rate of increase of companies in my database over time. And you can see in some ways it's just getting started. It's a very new industry. It's growing at about 8% a year in numbers of companies. Those companies are growing at around 10 to 12% a year, so it's about a 20% rate of growth of of revenue in this field. And these are 3 time frames. I'm going to tell you how the nature of that work has changed. In that first period, practice management, how do you actually run your healthcare practice was the top. And there were 12 companies dealing with that in that 1960 to 1980 period. Then there was drug benefit management. You saw that drugstore that we put up in the beginning. This is a very complicated thing. There are several hundred companies now in drug management, but at the beginning, there were only 6. And then you have the insurance functions, claim management, clinical laboratory data management, and so on and so forth. By the next 20 years, practice management stayed in the number 1 position, but now there are 131 companies in that field. So it was booming. And you can see that the areas are starting to change rather rapidly, and by 2000 or so, patient-provider communications, just talking to our patients has become number 1. I'm a director of Memorial Sloan Kettering. We have now an outpatient cancer surgery center. You go in the morning, you come out at night, having had a breast resection or a colonoscopy or something, and you go home that night. This is unheard of. The question is, now you're home, now what do you do? Well, you have a 300-page book that tells you what you should do. You can't go to Alexa and say, Alexa, my lung hurts. Because, first of all, that's not even legal at this point. And second of all, there is no such program to do that at the present time. I suspect there will be. So we're at the beginning part of this journey. We're not at the end. Within that, AI has been growing very quickly, very recently. So the digital healthcare delivery started, let's call it 2005, 2006. AI has really started in just the last few years. So the potential is in front of us. It's growing more rapidly than healthcare. And in the U.S., which is 53% of the total world, it's growing at around 11% a year. So it's growing a little bit faster outside the United States. There are 1,521 digital healthcare companies, AI companies out there. 25% in total, by the way, not just for healthcare. But 25% of them are in fintech. We all know a lot about fintech and what's been happening there. 7% are in healthcare. So for every one in fintech, in AI right now, there's for every 4 in fintech, there's one healthcare company. So we're at the very, very beginning. Those are the numbers. Customers, who's buying digital technology here? Carestream Health, Chindex, which is a wonderful general practice in Florida, the Columbia Hospital in Dallas, Fisher Imaging, GE Healthcare, Instrumentarium Imaging, Philips Medical Systems. These are some of the companies that are beginning to invest in healthcare AI right now. The investors include companies like these that you may know. You probably know Deerfield if you know something about healthcare investing. Draper Fisher Jurvetson, which you certainly know about. Khosla Ventures and Sequoia Capital are all part of that. I'll just back up for Sequoia. So it is beginning to attract real interest on the part of capital providers. So we have customers that are moving ahead, and we have investors that are starting to move ahead. How can we think about the industry structure? Well, let me give you the simplest one. You won't be able to read the print on this. This is a little product that I'm developing. This is generation 0.0. In a few months, we'll have 0.1, I think. So the print will be larger. But the yellow that you see there is the 4,200 or so healthcare companies. With the automated ontologies that we develop, have broken these into 4 categories. And these, I won't go through all the 4 categories because you can see it if you want in handouts. But this is, and the colors are the age, so green is newer than yellow, and the size is the number. So current operations is the biggest. But the structure is a little bit more complex than that. As I said, there are 89 public companies, 4,000 private companies, organized. This structure was organized by non-structured AI algorithms, 250,000 algorithms, iterations before the final one was presented, and there's the final one. this is one complicated industry. So if you're thinking of AI in healthcare and you think it's a simple question, the question is way too general. You have to be able to dig down in this and understand what's going on in healthcare. Digital healthcare is definitely complex. This is another way of looking at it. These are similarity cohorts using our AI algorithms to plot companies of similar kinds on a two-dimensional verbal axis. These have no units other than verbal similarities, so the ones at the top are most different from the ones at the bottom. The ones on the east are most different from the ones on the west. And you can see how scattered the industry is. Medical image management at the top, home health care, claims processing, and medical transcription to give you an idea of how broad this space is. Long-term care in the middle. You may not see much on this chart. You can see some little dots. Those little dots are public companies in this field. All the others are privates. So if you think you're going to analyze this and invest in public companies in this space, good luck, because there's virtually no information in looking at the public companies. You have to look at the private companies, and that's not simple to do, or you simply won't understand what's going on. And here's where they are geographically around the country. So unless we have capabilities like this, 4,200 companies, and it's growing at 10% a year, so 400 new companies a year or something like that, we're never going to be able to understand this industry without AI, in my view. Specific industry, population health, this is the one I told you about in the very beginning, where we treat populations of individuals. It's the management of the health outcomes of a group rather than individuals, including the distribution of outcomes within that group. So hypertension, for example, is a major one. I'm chairman of a company called Higi, which I personally think, and I've told everyone, that I think is a horrible name. It sounds like a skin disease or something. But I'm a new chairman, so I can say that. But you probably actually know it, because if you've been into a grocery store or a drugstore where you can get your blood pressure measured, 80% likelihood that that's a Higi station. So we're gathering that data, we're processing that data, and providing it to people who really need to know what the hypertension condition of the American public is. We gather much more. We gather 5 million data points a month, larger than the federal government on a systematic basis. Characteristics: 107 companies right now in this field that most of us had never heard of. 21 different areas, including performance analytics, care coordination, prediction and risk assessment, healthcare data, business intelligence. All these things I know because of these AI algorithms that we have developed to process the descriptions of these companies as they describe themselves. And this whole section started to also grow at about the same time the others. There are 369 companies, customers. There's that fly back here. It must not have gotten its fill on the last trip. Including Apple, Arise here in Austin, Baylor, Blue Cross Blue Shield. So the hospitals are getting a sense of what's going on. A hospital is an unbelievably complicated place. It operates 24/7. People are dying all the time. There's no time off. And when you say, could you just take a day and let's experiment with a new system? The answer is no, we can't do that. And so you find very slow rates of adoption in hospitals, and that's a major problem that has to be solved. And Tenet, you know those things. There's a 5-to-1 termination ratio here, so these companies go out of business fairly fast. In current investors, these are folks that you know. So there's plenty of capital waiting on the side. It is a very complex area to get involved in. However, it will, however, grow rapidly. TPG itself has 4 funds in healthcare. And in the last year or two, there have been 37 major acquisitions. So this is a big field. What are the issues going forward? Well, there's lots of room to grow. You just have to look at that chart and know that most of that chart is not well covered. Where some of the issues that I think about are where are the areas of greatest need: AI in population health, AI in medical diagnostics, AI in medical imaging. These are all huge areas. all with their enormous own complex problems. Which providers and payers are ready to move ahead? We don't know yet. We'd like to know. Maybe structuring them in the way that I've suggested here is one way to start. Is the industry ripe for consolidation? Do we need 4,200 of these companies? Or can we consolidate? And if so, is there an opportunity for capital providers there, and where are the best opportunities? What's the role for patient guidance in the system? We almost didn't talk about patients at all, but the role of the patient has got to increase. And what does that actually mean? Does that have any meaning at all? We have to figure that out. What about prescribing apps? There's a company in New York which is actually the result of an affiliation with a number of academic centers throughout the United States called Node Health. Node Health tracks 20,000 prescribed apps. 20,000 prescribed apps. So, and that's out of 200,000 that they filtered. So if you have 20,000 prescribed apps, all you have to do is go to your doctor and ask your doctor to prescribe an app. Oh, but your doctor's never been trained in how to prescribe an app. Your doctor has no idea how to get feedback on that. How does the doctor know whether you're better or worse? They don't. So we have 20,000 apps out there right now with no delivery system to bring them to the market. Does any of this result in a lower cost of healthcare, or does it actually result in a higher cost of healthcare because now we find out more people are sick? We don't know the answer to that question. And how can AI help? And what about the coming role of Amazon, Google, Apple, Microsoft, among others? If they do not totally change this industry in the next 5 to 7 years, I'll be flabbergasted. So we've come a long way since this little drugstore back in 1847. Where the future will be, I think, is definitely going to be digital health. I think we're all going to be affected by it. We're unprepared for it now, and Spark Cognition is going to lead the way in this field. Thank you very much.